Good afternoon. Who haven't I said hello to? I didn't get. Is that Paul? Are you Paul?
Chris.
Chris. Okay. Nice to meet you, David Johnson. We've met everyone else. One more fellow coming in. Alrighty. So, guys, thanks for coming along. Now, I just wanted to say I am hooked up to a microphone and I have got a video camera there, guys. So, I hope that no one objects to the backs of your head being filmed. Is that okay? Because I've just got to do a presentation on video. And I thought I'd take the opportunity to record this lecture. We're just waiting for Paul, are we? Is it Paul? How's everyone feeling today?
Not too bad.
Not too bad. Who's from Brisbane? Brizzy? Yep. And Sunshine Coast, I would imagine? Or where?
I'm from England.
England?
Yeah.
Holy mackerel.
Here
All right, and we've got a special guest as well. There, another. Yeah. Oh, Steph. Bring. Oh, can I have them up here, Steph?
Yeah, she's pretty good.
Send Paul in because we're going to crack on. Here he is.
Hello.
Paul, lucky last. Just flick that door shut for us, Paul. Thank you, mate. Paul, I just want to let you know I'm hooked up to a mic because I've got to do a recorded lecture, and I've got the mobile phone on camera there. So it's really just going to be capturing some of my slides, and later on we're going to use the whiteboard, and I just want to capture a little bit of that. So it's just it may have the backs of your heads in it, and it may go onto some social media and websites. Okay. So yeah, I'll introduce myself. So David Johnson's my name. I'm a brain and spinal neurosurgeon, and I run City to Coast Neurosurgery, which is very much integrated in with that space outside there, which is called the Functional Movement Training Centre. And we've got one of our staff, Luke, over there, that's going to talk to you a little bit later as well. You're going to get a bit of a lecture from me, from Mark and Luke. And what is our objective today? Well, what's the title of our seminar? It's really about back pain, because I presume you're all here with back pain. I've certainly had a look at all of your spinal imaging, your MRI scans of your backs, of your lumbar spines, because you suffer from persisting back pain. You wouldn't be here otherwise. And so the title of our talk is The Elegant Solution for the World's Most Vexing Problem. Okay. Vexing really just means it's puzzling the world, and you'll understand why as we move through the talk. And what are our objectives, our goals? We want to educate you about your back pain. That's absolutely paramount. That you understand why you're feeling pain, and you understand what pain means, and you understand what the real cause of your pain symptoms are. Because I see patients every day of the week, and Mark's the same. People will have months, years of back pain, and I ask them this typical question as to what is actually causing your pain, and they really have no idea, or they'll say something like, it's because of my bulging disc. Okay, and that's really misinformation and a myth that a lot of patients have implanted in their brains over the years by the different therapies that they've received, and different specialists and various people along their journey have implanted into their brain, and it really becomes counterproductive to their recovery when they have a lot of misinformation. So we need to dispel some myths. Okay. Once you understand your pain, and once you are more knowledgeable about your back, we then need to give you a solution. Okay, so that's what we refer to as the roadmap. There's no point having all this knowledge if, okay, well, I know now why I've got pain, and I know what's causing my pain, but what do I actually do now to get rid of the condition? So back pain symptoms are ubiquitous and indiscriminate, and very, very costly on our society, okay? And what I mean by indiscriminate, a lot of people think that they have back pain because they're sedentary, okay? or because they might be overweight, they might have been told that they have weak core stability or core strength. Okay, you've probably all been told you've got to strengthen your core, etc. They feel tight across their back. Or a lot of people are told that they have back pain because they're just getting old. And going hand in hand with aging is degeneration and therefore pain. Okay? But the advice then becomes, if you believe that these are the causes of your pain, the advice that you will receive is going to be, okay, well, get active, lose some weight, strengthen your core with things like Pilates or planking or various gym-based programs. If you're feeling tight in your back, I'm sure you've received some form of manual therapy, because the releasing of tightness. And if you're elderly, people have just said, you know, take some tablets and don't do things that hurt you. If it hurts you to play lawn bowls, don't play lawn bowls anymore. If it hurts you to go for a bushwalk, don't go for a bushwalk anymore. And that's not really what we're about, because if we ask that question, does inactivity cause back pain? Does being overweight cause back pain? Does having a weak core cause back pain? Does having tight muscles, tendons and ligaments cause back pain? Is age and wear and tear the cause of back pain? There is no scientific evidence that that is the reason for back pain, because we know full well that people have back pain and they're already active. Okay, so I can have an Olympian with back pain. I can have a triathlete. I've got one of the Noosa triathlon champions who's a back pain patient of mine. So you can't say that his back pain is because of inactivity. I've got people who are very large and overweight with back pain, and I've got people who are very skinny and underweight with back pain. Okay, I've got people who have never done any core strength work who have back pain, and at the same time I've got people who go to the gym every day and have got really ripped abs and a massive amount of core strength, and they have back pain. So what I'm trying to point out by this slide is until you actually understand what the discriminator is, a lot of the messages that you're getting are actually incorrect. Because in clinical practice, we see this every day. I'll see someone who's a bank manager with back pain, and then I'll see a brickies labourer with back pain. So hang on, I cannot therefore say being a sedentary bank manager is the cause of your back pain. And I also can't say that being a brickies labourer is the cause of your back pain. I'll see someone who's skinny and lean who has pain symptoms, and then I'll see someone who's overweight and has back pain symptoms. So that it's a unsound philosophy or paradigm to say to someone who's got a weight problem or something, one of those other elements, to go and sort that out, when you know that that's not actually the discriminator that causes their pain symptoms.